If you picture your breast and your nipple starting to be at the bottom of that circle, then that's not an ideal location. And if you have that descent of the nipple, then you are probably a really great candidate for a breast lift.
Hi guys, welcome to Lipstick and Lipo. I'm Dr. Smita in New Jersey. I am joined by my co-host and dear friend, Dr. Ashley Amalfi up in Rochester, and we are continuing our series, Am I a Candidate? And today we are talking about breast lift. So I feel like this is one of those procedures, Ashley, that there's a lot of confusion about, right? Everyone comes in, they want a breast augmentation, and then they're shocked when we're like, oh no, actually we need to add a lift in there. So I think it's great that we're talking about this, and I hope it helps you guys sort of at least get some thoughts in your head before going in to see your surgeon. But ultimately, you always want to go see your board-certified plastic surgeon so that they can really examine you and understand your goals and give you the best options.
Right.
So Ashley, what are things that we're looking for when it comes to a good candidate?
I mean, you really want to know, is your nipple and the tissue in the right position? And how do you know that? You know, I've even had patients say, like, where is it supposed to be? Because a lot of times you've lived with it so long, or your skin has been like on the looser side and your breast has sagged from a very young age. So where should that nipple be ideally? And I always tell patients, you know, if you picture the breast as sort of a round circle, the nipple is supposed to be the bullseye. The nipple is supposed to be in the middle of that circle. So if you picture your breast and your nipple starting to be at the bottom of that circle, then that's not an ideal location. And if you have that descent of the nipple, then you are probably a really great candidate for a breast lift.
Yeah, absolutely. And then I think the other framework that we use too is if you look at that crease, right? And the breast sort of overhangs over that crease. But if that nipple is also under that crease, that's another sign that it's sort of shifted to a lower position. And ultimately, I think we need to just say this, like, all of this is normal, right? Our breast changing, size changing, shape changing, nipple position is all a normal part of aging, weight loss, pregnancy, whatever it is, it's all normal. So whether or not you want to get a procedure done is a personal decision, right? That's just for you if you want to improve the shape or change the shape of your breast, but by no means is this like a correction, right? We're not correcting anything because aging is normal. So,
we just set the clock back to like a youthful breast and ideal form. But any variation of this is normal. But if you don't like it, if you look in the mirror and you're like, ugh, why don't I like the way that this looks? Then just think about those landmarks. Think about your fold. Think about the breast being that circle shape and think, okay, maybe this is actually what I don't like about my breast. A lot of patients, I don't know if your patients to come in doing this, they kind of like grab their skin and pull up on their breasts and they're like, this is what I want. And
they do that all the time.
All the time. We're not going to make big incisions up here on your neck, we promise. So we have to sort of do it discreetly, like, very technical origami to lift your breast in height incisions in really satisfactory places. But if you're someone who looks in the mirror and does that, that's probably a good sign that you would love the results from a breast lift.
Yeah. And I think the other thing is also, that's so funny, first of all, because a lot of patients, when I start going through incisions and stuff like that, they're like, well, I thought you could just make an incision at the top of the nipple or areola and just like lift it up. I'm like, no, you can't do that. But also you definitely don't want incisions up here, right? Because that's where things can be visible in clothing. But yeah, I think the other thing to also, that might be a sign that you need a breast lift, is if your breasts, like you said, you want that round appearance, but if you're starting to notice that they're just getting long, right? Yeah. You take off your shirt, your bra, and they are more like oval shaped, or even rectangular, like based on how the tissue is settling. Well, that's a sign that you probably need a lift, in addition to whatever other procedure you're getting done.
Yeah. And when we make everything tight, you know, the other thing you want to think about if you're a good candidate for is that your breast needs to be stable. So we don't want your breast growing. So if you're someone who gains or loses weight and your breast changes significantly, you want to be at a really good baseline, because we're going to make things tight and perky at the size and the weight and the cup size that you are, because this does not change your cup size. And what you don't want to do is gain weight and then have your breasts like expand and get very heavy, or do the opposite, like lose weight, because when you lose weight, sometimes your breast gets deflated and it will sag more. You want to be at that ideal weight and breast size so that we can give you the most ideal shape that you can.
Mm-hmm. Yeah. Yeah, I think that's so important, right? And that really ties into really anything that we do, right, Ashley? When it comes to anything on the breast body, you want to be at your ideal body weight, because ultimately you don't want to get into that pattern of getting surgery done every few years because your body is changing so much.
Right.
Nor do you want to make that big investment and take the time off to recover and do all of this hard work. And then sort of lose these amazing results because your body changes. So ultimately, there's certain changes that we can't avoid, like aging and things like that. But things that we can control, like our weight, we want to, you know, sort of stabilize that as best as possible. And it's not going to be perfect, right? 5 pounds here and there.
No, that's not going to change
up to 10 pounds, not a big deal.
No.
But you don't want these big weight fluctuations, like 20, 30 pounds.
Yes.
Like that's going to change your results.
Absolutely.
So find your ideal body weight, something you can maintain, and that's where you want to be when you come in for your procedure. And then the other thing that sort of ties into is after pregnancy and breastfeeding, right, Ashley?
Yeah, I mean, a lot of people really want a breast lift after they've had a child and or breastfed, but you have to remember that for safety reasons, we want to wait a little bit after you've been breastfeeding, usually 6 to 12 months, because when we're doing a lift, we are cutting into the ducts of the breast tissue, and even long after you've been breastfeeding, there's still milk in those ducts, and that's just it's just an infection risk for us. And so we want to make sure that your breast goes down to its normal size, because we don't want it swollen with milk, because we all know that they get bigger with breastfeeding. But for safety reasons, I think you and I are pretty aligned on this. We are usually 6 to 12 months after breastfeeding to get that lift. Is that your timeline too?
Yeah, absolutely. I would say a minimum of 6 months.
Yep.
Obviously, closer to that 1 year mark is really going to be ideal, especially if we start talking about adding in implants as well.
Yes.
You know,
infection.
putting it, infection rate is going to be higher, even if, you know, and the thing I think that tricks people is you might have stopped breastfeeding and you might not actually be lactating, but there's still sort of milk in those ducts, which when we're operating in there, that's when we see it, and that can be an issue.
Yeah. I mean, it's so surprising. Like sometimes we'll operate on women who stopped breastfeeding multiple years ago, and there is still residual milk in the ducts, you know, like women as far as like 2+ years out, and there's still remnants of milk in the ducts. I mean, the body is absolutely amazing. And so that's why we're just being so cautious, because the milk itself can have some bacteria in it, and we want you to have a great result. You know, infection risk in breast surgery is super low, and we want to keep it that way. We don't want to add any other elements that make it risky for you, because we want this to be controlled and safe, and for you to have a really reliable and consistent result. So that's why we're making you wait, not to torture you, just so that you can have the absolute best result that you can. A lot of patients will call and they'll be like, I'm done. I stopped breastfeeding. I'm done. And so it's like, we can't do it that day, but let's get you in, let's check it out, let's evaluate you, and then let's put something on the schedule in the future so that as soon as you're ready and it's safe to do it, we promise we want to help you as much as you want it.
Right. I mean, I think that's so funny that you say that, because we're not here to torture you, right? And I think that's why it's so, and I mean, we drill this home all the time, but it's so important to go see a board certified plastic surgeon, because we understand all of the risks that can happen and what things mean, right? And so we're not like randomly pulling things out from thin air and like, you know, all these random restrictions and rules, but there's a reason why we're doing that, because ultimately we want you to have the best and safest results, and not, and things that we can control beforehand,
Yes,
we want
exactly.
to control.
Exactly.
So you don't want to, like, this is not one of those things where you're just so eager to get your procedure done and you see a board certified plastic surgeon and then you go see somebody else and they say, yes, we'll do it. I mean, just be patient so that you really have great results. And a board certified plastic surgeon will help sort of steer you in that direction.
Love it. Yeah, absolutely. Breast lift patients are so happy. So if you think you might be a candidate, just give us a holler. We'll do a consult, no matter where you are in life, in family. Anyone can be a great candidate for a breast lift if that's something that you're looking for. So check us out. We are excited for more in our Am I a Candidate series. So stay tuned. Make sure you guys are subscribed on Lipstick and Lipo on YouTube and Spotify. So listen or watch, and we'll see you guys next week.
I'll see you guys soon. Thanks for tuning in.
Bye.